Well, welcome everybody. We'll get started on time so that we can all get back to our evenings. I'd like to say good evening and welcome to tonight's webinar on the My Health Record and electronic referrals. Thank you for taking the time out of your evening this evening to join us. My name is Angela Heathcote and I'm from Eastern Melbourne PHN. Together with my colleagues Kirsty and Josie, we welcome our guest speakers tonight, Eric Dunn and his colleagues from SR Specialist and Referrals. Eastern Melbourne Primary Health Network is primarily funded by the Australian Government to improve the care and support people receive from health services. We aim to improve the health of our community, which includes using technology to make the broader health system work more efficiently. I'd like to begin by acknowledging the Wurundjeri people and other people of the Kulin Nation as the traditional owners of the land on which our work in the community takes place. We pay our respects to their elders, past, present, and emerging. Tonight, we'll be discussing the electronic referrals and how these may assist you in your practice and care coordination. Before we begin tonight, just to let you know that we are all on mute. You can ask at any time questions by typing them in the chat box. For those questions not covered in the presentation, our guest speakers will be more than happy to answer these at the end of their presentations. Tonight's webinar is also being recorded and all attendees will receive an email with a copy of this recording, copy of the presentations and also any relevant resources from tonight. At the end of tonight's webinar, you'll receive a short survey, so I'll be very grateful if you could please take a minute just to answer these at the end. So without any further ado, I'd like to hand over to our first speaker for the night, Eric.
Oh, well, hi. Thank you. It's nice to be coming on a bit earlier. That's great. I'll just share my screen. So hi everyone, my name is Eric Dunn and I'm the presenter for this section on EReferrals. Just need to move a couple of things around on my screen. I also would like to begin by acknowledging the traditional custodians of the land on which we meet and pay my respects to their elders past and present. I extend that respect to Aboriginal and Torres Strait Islander peoples who may be on the call this evening. A quick bit about me. I've been in information technology for over 20 years, the last 8 in digital health, most recently 4 years as the digital health manager at the Sydney North Health Network. I now help specialists and GPs with EReferrals at SR. Tonight, we're going to talk about the existing referral process, how we've collaborated with other businesses to make the EReferral process easy, why use SR Referral, why you're probably already live with SR Referral and how easy it is to get set up if you're not. Then a quick demonstration on SR Referrals in Genie and a demonstration for those that don't have Genie. And finally, how we can help and an opportunity to get your questions answered. So by the existing referral process, I'm talking about letters, faxes, and emails. There are potential problems with the handover of patient data, like did the whole fax go through with all the attachments? Did it go to the right person? There's a huge amount of time spent scanning paper documents, both at GP practices and specialist practices, attaching scanned documentation to patient information in the clinical system, following up that the referral has been received, and retyping patient information. Referrals that go to a practice where a specialist no longer works will mean extra time following up and sending it to the correct practice, or contacting and finding another specialist for the patient. I've had clinicians express to me their frustration with the time spent on administration, not to mention the frustrations of the administration staff themselves. GPs and specialists have had secure messaging systems for years. So why no EReferrals? Well, possibly because there are multiple directories. Each hospital has its own directory. There are paper directories and online directories. There are multiple secure messaging providers. Specialists also move around between hospitals and practices. GPs have multiple templates for different systems, out-of-date templates. And you have to know all of this before you even start an EReferral. So there's no confidence in the system. It's easier to just send it by fax and deal with the fallout from that. So what have we done about it? Servant Media have collaborated with HealthLink to provide an end-to-end solution for EReferrals called SR Specialist and Referrals. I'm sure you all know about the Medical Specialists Directory, but if not, it started in Australia in 2000, and it now has a listing for every specialist in Tasmania, Victoria, New South Wales, and the ACT. It is curated so every entry is validated and up to date. It's available to you at no cost. And if you don't have one and want one, let me know and I'll send you one. SR Specialists and Referrals is the electronic version of the Medical Specialists Directory that is integrated into Medical Director, Best Practice, Genie, and other clinical software, with more coming all the time. HealthLink provides a secure messaging service widely used by most general practices and specialists. All specialists with a HealthLink EDI, that's an address, can receive SR EReferrals. It is free for specialists to register for an EDI address. And HealthLink have created SmartForms and integrated them into the clinical software to make the referral and data transfer process easy and secure. Using SmartForms is becoming an everyday activity for GPs, and they're currently available for hospital referrals, My Aged Care, Fitness to Drive, and SR, with more to come. So why SR referrals? Well, we've streamlined the e-referral process end to end. With faxes, the GP rarely sends the fax. It goes to the admin staff. With SR, the GP sends the referral directly from their clinical software. It's instant, and the patient can be given the specialist's information on the spot. The referral contains all the pertinent information on the patient that can be directly imported into the specialist software. For GPs, they only need to look up one directory for all specialists because it's always up to date and identifies the referral pathways. There is one template for all referrals, regardless of whether they're electronic or manual, that is print or fax. It meets the requirements for GP accreditation and EPIP, and they can provide the patient with information on the specialist via email or print. For specialists, less printing, scanning, and data entry. The referral is received instantly, it's easier to find, there's more information on the patient, which can automatically be imported into your software. As for the directory, it's easy to update your information on the directory, and the GP will see your updated information immediately. There is much more that we're going to show you in the presentation. So how to get set up? Well, you're probably already live with SR. If you have HealthLink and Genie, you are live for SR. Ask your staff to check the incoming letters in Genie. Check out your details in SR and let us know if you have any updates, or just contact us for support and training. If you have HealthLink and other software, and your software is compatible with HealthLink SmartForms, then you are live for EReferrals. In that case, just contact us for support and training. If you don't have HealthLink, register for a free HealthLink EDI address. If you're on compatible software, then HealthLink will remote in to set up your messaging. If you're not on compatible software, then you can be set up with a portal account, which we will show you in a minute. Once your HealthLink account is set up, we will turn on your SR EReferrals. So let's see how easy it is to use SR. Standing by online, we have Nicole, our resident Genie specialist, and Carmel to help answer questions and to show us how to check your details in SR, find referrals in incoming letters, search for referrals by patient name, link a referral to an existing patient, create a new patient and link the referral, and on-refer patients using SR and check the delivery status of referrals you have sent. And they will also show us how the HealthLink portal works, how to log in, view and save referrals, search for referrals by patient, name, and how to check your details in SR. So I'm now going to hand over to you, Nicole. Are you there?
Hello, hi. Can you guys see me? No.
Not yet.
There we go.
There we
Hello,
go.
hi. So I'm Nicole and this is Carmel, and we're just going to run through using SR in Genie software. So I'm going to share my screen. There we go. Okay, so what we're going to do is we're going to start off in a patient record, because obviously if you need to make a referral, you have to be in a patient record. So to find HealthLink, we go Tools, HealthLink Online, and then New. And this brings us to the HealthLink landing page with all the smart forms that the GPs use on a day-to-day basis. We're over here, the SR in red, and you click on Private Specialists and Referrals. Okay, so here we are, a picture of the medical specialist directory Eric was talking about. And the search functionality here is a way of searching the medical specialist directory electronically. So to start off with, I am going to select a category. I'm going to do a broad category. Let's go for neurology and search. Now here you can see we've got a group that's come up and some specialists that have come up, with a mixture of ERefer and manual refer. Okay, this group over here does not have a referral button at the top there. So let's click on that group page and you can see more information about the group, and then you can choose which specialist to refer to. And there's a bit more information below each specialist to help you make that decision. But I'm going to go back to my search results and refine by location, because there are just too many results over here. So let's type in a suburb, Bandura, and I'm going to search again. And now I've got my results have been refined to just 6 specialists who work in Bandura. So I choose the specialist I'd like. And what I would be doing is choosing a location to make that referral to. I'm not going to do that now because this is live and I don't want to send a referral to the specialist. That would be a bit of a strange one. So let's do another search. And while I am searching, I just want to say that even though you as a specialist might not want to be making a referral today or soon, it's always good to have a look to see how you are represented on SR, because what you see here is what the GP see and other specialists see when they use SR. So let's do another category. I'm going to choose cardiology and search. Again, lots of results in cardiology, but in this case, I'm going to choose a subcategory, pediatric cardiology. I click there and down to 15 results, again, with a mixture of ERefer and manual refer. Now, a manual referral is exactly the same as an electronic referral. I just have to print it out and fax it at the end instead of it being sent by HealthLink, but the same process. To get these results, I could go along, I could do a search, do the same search, but a different way. So here we go, search. I'm going to select pediatrics this time. There we go, and search specialists. And I've got my subcategories, pediatric cardiology. There we go. What I could also do is search by keyword. And instead of doing a category and a location, I just start typing and I get some drop downs, pediatric cardiology. And there we go, same results. So there are various ways of getting or finding the specialists if you don't know who to refer to. And a lot of specialists have more information on their page to help you make a decision as to who to send to. But I'm going to show you what to do if you do know the specialist's name. So if you know the specialist's name, the easiest thing to do is just type it in, and surname is best because there are shortenings of first names and nicknames. So our test specialist is Mickey Mouse. I'm going to choose him and search. Now, here we go, Mickey Mouse. I have got a few addresses for Mickey Mouse, one manual refer and some ERefer addresses. Now I'm going to choose the address I want, click on that address, and this brings us to the SR SmartForm. So this SmartForm is similar to other HealthLink SmartForms in that the information is pulled through, a lot of the patient information is pulled through from the patient record. But at the top here, we have the specialist details, and this is pulled through from our database. So this is the Medical Specialist Directory database. So again, it's a good reason to keep your contacts up to date. Below that, we have some information that the GP or specialist needs to fill in. A specialist referral would be 3 months. And a reason for patient referral is absolutely essential. You can browse consultation notes as well, but the referral won't be sent without these red star bits being filled in. So next, I am going to attach some attachments. So there's 2 ways I can do this. The first one, I can choose an attachment in the patient record. Here I'm going to choose the iron studies, and I'm going to attach. Really easy. If I'm not sure I've got the correct attachments, I can do a quick preview. And there you go. I know I've got the correct attachment. I can also look on my computer for any documents that haven't been attached to the patient record yet. So let's go browse. I've got my X-ray, open and upload. So that's been done. The next 3 sections, most of the information all pulls through from the patient record, and you can choose what you want to be shown, or you can remove things that you don't think need to be shown. The patient details all here, again, from the patient record in your software. The last section over here, the referrer information, that pulls through from your software. So I'm the person who's sending this referral. This is the information that's been uploaded to my software. So what I'm going to do now is I'm going to submit this referral. Now, I sent this referral to my portal account, and we will have a look at that in a few minutes. But firstly, I want to talk about this letter. So the referral letter is really clear. You can see it is all here neatly laid out, and it does mention the attachments at the bottom. I've also got the SR number over here, which is a referral ID. This is unique for each referral. And it's good to, sometimes we use that referral if we can't, to help track a referral that has been sent, especially if we don't have the patient name, because we at SR, we call the specialist all the time to check that they've got referrals, but we don't get any patient details. We work from the patient ID as well as the date and timestamp. So at the top here, we've got the note, referral sent and acknowledged, and with the date and timestamp. Now that means that HealthLink has taken that referral and is delivering it on your behalf. I could still print that referral out and give it to the patient, but it has been sent electronically and HealthLink does have it. Now that does not mean that a specialist or anybody has seen that referral. I'm going to close out and go back to here where we first came to HealthLink. Instead of hitting new for a new referral, I can see all the referrals that I have just sent. So this is the referral that I sent a couple minutes ago. Now I am based in New Zealand, so my time is slightly different to you. And you can see the form has been submitted. Now most of these referrals here say acknowledged, and that means that the referral was sent to the specialist software and the receiver's software sent back an acknowledgement. So we do know that those have been, they are in the referrer's or software. Not referrer software, the receiver software. Now I've got a few here that say form submitted. That usually means that we're still waiting for acknowledgement, but not all software acknowledges. So you don't be too worried about that. The main thing you need to look out for is if you see an error message. Unfortunately, I don't have one to show you. They are very rare, but they do sometimes happen. Sometimes the attachment is corrupt or something like that, and the referral does get show an error message over here. I've got one that's a bit unusual. If you see this over here, we've got a PO, and that means that this referral wasn't sent electronically. The form was made with HealthLink, but PO stands for printout, and if you view that referral, you can see that it was sent manually. So this referral is to be printed and sent by fax or email. It's the same process for whoever sends the referral, just that it has to be printed out at the end and sent by fax or email. So I'm going to close that. And so that is where you see all your referrals or all your HealthLink correspondence that has been sent from this patient record.
Just a quick note on that, GPs can check this log in their own software. They see this information, so they know when they've sent their referral and when it's been received at the specialist end. So that, yeah, that's really important that they can see that information as well. When Nicole referred a moment ago to the phoning, that's when we do the first time referrals go through. We're just checking to make sure that those referrals are being, that the training's happened and that specialists at the receiving end know where to look in their software. So we're providing proactive support around that.
Yeah, no problem. So that is how you send a referral and how to check on the status of your referrals that you have sent. So I'm going to close that because I'm guessing you want to know where to find your referrals. So finding referrals is really easy in Genie. You go to Open and Incoming Letters, and everything comes into Incoming Letters. So usually this will be set to the doctor's name, but we recommend setting it to all, because sometimes if there's a spelling difference in the name, the Genie will make a new folder, a new specialist folder, and they might get missed. So this way, if you set it to all referrals will come in. And this section here is unlinked. So unlinked referrals need to be actioned. And this is where you should be checking for all your unlinked correspondence. Pathology reports should be coming in here as well as discharge summaries, things like that. So let's click on that first referral. I've opened that first referral. There's the actual letter. You can see there. And you can see that Genie has matched it up to a patient in my database. So I've got the name there, David Anderson has been matched, and the date of birth and the Medicare number have been matched. So there's 3 equal signs over there. So because I'm very confident that this is the same David Anderson that is in my software, all I need to do is link. It makes a note that I've linked it, and it moves on to the next item in my incoming letters. So Genie has got my next referral, and I do not have a match on name here, or I don't have a match there. So I know I do not have this patient in my database. So what I'm going to do is I'm going to hit the plus sign with the man, and I'm going to make a new patient record from this referral letter. So there we go. I'm going to save that. And then I'm going to link this referral letter to that patient record. And again, Genie has moved on to the next letter in incoming letters. I'm going to close out of that and show you Donald Duck. Now, I know I have Donald Duck in my database because that is my test patient. I send lots and lots of Donald Duck referrals. So if I open this letter, I can see there's a match, Donald Duck, Medicare number, and date of birth. I would just need to link it over here, but if I go back to the patient record, and remember Donald Duck is my test patient, I've got my notification here. So Genie is telling me there is 1 unlinked letter for this patient. Now, this is where most practice staff find referrals. And I do get told pretty often that they can only accept referrals for patients that they have in their database. I'm just going to link this here. I'm going to click 1 unlinked letter. It takes me to exactly the same place, but it only shows referrals or letters for Donald Duck. So I click on that and link. There we go. There we are. So managing incoming letters is actually really important because, as I said, a lot of practice staff only see the referrals in the patient letter. But if you check incoming letters every day, you can see patient referrals for patients that aren't in your database. And that's a great way for getting new referrals. And with the way SR works, with GPs and other specialists being able to search by category and location, you will be getting referrals from GPs who've never referred you before. So it is important to check incoming letters. You have anything to say there?
Good.
No. Okay, so you have now seen where your incoming letters come in and how to link them from the patient record. I do want to show you the portal. So there is that referral I sent a few minutes ago. I'm just going to log into my portal. Sorry. Need to bring this down a little bit. Oh, come on. Just need to bring it down. There we go, got it. Okay, so here's my portal. Now I have a portal account for doing demonstrations. So I log into my portal account and the referral that we sent a few minutes ago is here. You can see the date and timestamp, so that was when we sent it. So I'm going to open that referral letter. And the reason I want to show you this is, again, just to show you that the specialist details are at the top here, all clearly laid out, the patient details, and then the referrer details. But what's really good about seeing the actual referral and not just the PDF is the attachments that I sent earlier show in the body of the referral. So that there's no separate attachments to download or look for or print separately. They're all in the patient record. And once this record, and they're now in the patient record if you're in Genie. So I'm just going to go back to the inbox. So my inbox is pretty full because I do send a lot of test referrals. But what you can do is you can search by patient name. And as a specialist, you can find that referral. And that's actually way easier than searching through a pile of faxes, even if the faxes are in alphabetical order. What I'd also like to show you is you can send SmartForms from the portal as well. And here are some of the SmartForms that GPs or you can use. And again, specialists and referrals. Now this shows exactly the same functionality as what we saw in Genie. The only difference is you will have to fill in all the patient details because there's no patient record to pull from. I'm just going to go back to Genie now. Are you good? Do you have anything to add? No? Okay, so to recap, if I want to send a referral, I go Tools, HealthLink Online, New. This takes me to the HealthLink SmartForm landing page. I choose Private and Specialists and Referrals. And then you get to the search part. If I want to find my referrals, I go Open, Incoming Letters, and there are my referrals that haven't been actioned and need to be actioned. And the linked referrals show everything that I've already worked on. I'm just going to change the date order. So you can see the ones that we worked on earlier. And sorry, totally blanked out there. And this way you've got a referral, you've got a record of all referrals that have been sent, or all referrals that have been received, or all documents that have been received into your incoming letters. So ones that need to be actioned and ones that have already been actioned. And I think that's it. Can I quit my screen share? Is there something you want to say? No, all good. Okay, so I'm going to stop screen sharing and we can take some questions.
Actually, thank you so much, Nicole. That was awesome. I'm just going to go back to my slides for a second. I think that's working. So did you, that was really amazing. Thank you so much for that. I really appreciate you doing that demonstration. And if you could stick around, well, Nicole and Tom will stick around for a minute and help me answer a few questions. Did you spot how to search for patients and create a new patient from the referral? That's got to be a major time saver. So you should be able to get into SR and check if your details are correct and if all the clinic locations are set up for EReferrals. And I've got to get this working. And also, did you catch how easy it is to use the portal? And you can receive email notifications every time you are sent a referral, so you know when to log in and check for it. So whatever your workflow, if you're working with faxes, storing your referrals, or waiting until the patient calls, if you call patients to confirm, We can help you integrate SR into your workflow so you can reap the benefits of electronic referrals that work. We provide extensive free training for your staff and are happy to contact the GPs who refer to you so that they can use SR as well. So our sole purpose is to help GPs and specialists, and we've been doing it for 30 years. We're sensitive to your requirements and admin processes, and our tools will make your life easier. Feel free to call us or email us with queries or for training. Let us know if you'd like email notifications set up for new referrals. And if you have a particular GP practice that you'd like to see shift from faxes to e-referrals, let us know and we can contact them and offer training. As for updates, if a specialist joins or leaves your clinic, or if you're changing your contact details, if you're adding or removing consult locations, and if you're doing telehealth consultations, please contact us and we can update your information anytime. Also, you can improve your profile. The basic entries are free. You can improve the quality of your referrals by including information on your services. You can include a photo and be found under multiple categories. Paid entries are annual and are a package entry. So you get into the medical specialist directory, SR and ozhealthpages.com.au. So thank you very much for your time. I'll hand back to Angela and see if there are any questions.
Thanks, Eric, Nicole and Carmel. We have had a couple of questions come through. Tamara has asked around if we can actually find a cardiologist within the directory. How do we go about doing that? You mentioned about being able to access the directory. So what's the best way of contact to do that, Eric?
Can I hand that one over to Carmel?
Do you want us to demonstrate finding cardiologists in SR?
It's if somebody wants to know if there is a cardiologist listed in SR and they haven't got access to it at the moment, how do they do that?
Oh, we can look it up here quickly. Do you want to see it live?
Screen.
Yeah, let's see.
So would you like the name of the cardiologist?
Let me just get my screens shared, and yes. Okay. I'm just going to new. May I get the name, please?
Dr. Nicholas Cox, COX.
Okay, I'm just going to type in Cox because that's easier than Nicholas. There we go, Nicholas Cox Cardiology, search specialists. And if I click on Nicholas Cox, I have got him at Victorian Cardiovascular Services with 3 locations.
There we go, Tamara. So if there is details there that need to be updated, how do they contact you to do that?
Our email, the SR support email. So that'll be on the information that we send out. So
Yep, fantastic.
Send an email or just phone us. Yeah.
Fantastic, thank you. Another question here from Kim. I'm a paediatrician who hears from GPs once or twice, but I'm more interested in referring and sending this info to allied health practitioners. Do you have any questions around that?
Yes, well, currently
we don't have allied health live at this stage. That may well come in the future. So we've Eric mentioned before, we've been providing this information for 30 years in New Zealand as well as in Australia. Our New Zealand service of SR is now opening up to allied health. So yeah, we're constantly evolving, and I'm sure we'll get to the point one day where we also have that information for allied health.
Fantastic, thank you. I think that's all the questions. I can't see any more coming through. Oh, hang on a second, there is a couple more. How well does HealthLink forms upload to ZMed? We are cardiologist specialists and have received cardiology referrals from HealthLink Specialist record. We also perform diagnostic imaging on GP referrals, but have not received any referrals by this medium. So information in regards to obviously the functionality in ZMed.
Okay, so as far as receiving specialists and referrals, as far as receiving an SR referral, no problems in ZMed. You don't need a portal account, you just need a HealthLink EDI, which it sounds like you do have.
Yeah.
That makes sense?
Yes. Sorry, I was reading the other questions.
No, it's fine. I had to think of that, quite figure out the question. But yeah, ZMed's absolutely fine. Great to receive referrals into ZMed.
Fantastic. I think that's most of the questions here. If there's any others there that we've missed, we can go through, but I think that's most of them for now. Is there anything else that Eric and Nicole and Carmel that you wanted to present to anyone tonight?
Well, I would like to say to that practice who said they haven't received any electronic referrals, if they get hold of us, I can see what they look like on SR, show them what they look like on SR, but also we can contact their high referring GPs and speak to the GPs saying that they'd like to receive referrals by fax. And that's a great way for us to get in and promote SR to GPs. So please get hold of us. It makes everything easier.
Fantastic.
Similar to this training session, we are running ongoing training sessions with the GPs, and we've also had a presence when the conferences are happening. We've been at the conferences. Obviously, in the printed book that goes out, there's information about the service to GPs as well. So there's definitely a growing uptake of referrals coming through by GPs using this service. And we're really excited to be able to support it, and that's our key role. In New Zealand now, the bulk of electronic referrals are sent through SR. So we're on a pathway similar over here, which is really exciting. But it's a case of working together, matching up the GPs and specialists that want to send and receive electronic.
Thanks, Carmel. One last question. We have somebody asked, if my books are full, how do I tell referrers this? How can I notify this on your system?
So you can place a message on SR, and we do often what we encourage people to do is to include information about exactly what their services are so that they don't get inappropriate referrals. When people retire, we often put a message up to say, rather than someone drop out of the system, we can actually put a message up saying that they're no longer taking referrals. So that is an option. We prefer to place a message than to delete people off, because then the GP thinks that the information is incomplete. So that's the way we normally handle changes of status like that.
Fantastic. Thanks, Carmel. I think that's all the questions. That's everything come through. Yep, so I got a thank you. So I think that's it. Thank you. Well, thank you everyone for attending. Firstly, I'd like to thank Eric, Northern New South Wales, and Nicole and Carmel from New Zealand. So we've had a broad scope today. I'd like to thank you all, also the attendees, for attending tonight. We've got an earlier mark, so I'll let you get back to your evenings. Please, if you have any other questions that we haven't answered, please contact us on the email that we provided on the registration. But if you can please complete your survey as you finish up tonight for all feedback for us all. So we thank you, and good night to everyone. Thank you.
Thank you so much.
Good night.
Good night all.